What we're going to do now is have a look at actually using an AED. Now we're in a training room scenario here, so we're using the mannequins, and in the real it would work the same, but you'd work much quicker. Obviously I'm breaking this down into individual stages, so it's just to make it easier, you know exactly what you're doing. First thing we're going to assume we've already walked into the room, we've found the person on the floor, we've done scene safety, and obviously I've got my gloves on. The initial stages we would have been done already. We'd have already introduced ourselves, trying to get a reaction out of them, open the airway, found out they're not breathing, and continuing CPR. So this is the moment we're taking on from when the AED arrives. So the first thing we need to do is we need to put the pads onto bare skin. So first thing we do here is literally take off the clothing just to expose the chest. The reason we do this is because we need to put the pads onto bare skin. Now we would need to take off any clothing that's there, including bras or any underwear that's on there as well, because we must make sure we get contact with clean skin and there's nothing going to be in the way. We're also going to have a visual inspection around to make sure, maybe we could even at this stage see that there's a pacemaker inserted, which you'd see under the skin here. We'd maybe look for other scarring, which might indicate that the person could have had some heart surgery, something like that. We're also looking for any obvious patches and jewellery. Now some of the patches have metal in them, and this can in some cases cause a problem. But if not jewellery, if they're wearing a necklace, you just pull that up out the way or take it off, because we don't want the electricity to be transferred through the necklace and not through the heart. So we're checking the entire area is clear. Now in the real world of doing this, especially if there's two of you, one could get the AED ready and the other one could carry on the CPR. It's crucial that we keep this CPR cycle going the whole time. Now remember, the quicker we get this AED unit on, the better. Every minute, the chance of survival drops 10%. So if we can get it on within 4 minutes, this person's chance of survival is much better than maybe 8 minutes or more when the ambulance turned up. So we're ensuring the area is completely clear. For this example, maybe in the real world, someone will be doing CPR, maybe from the other side, while I get everything ready. Now the AED unit is sitting up here, it's close to me, so I can get access to it. I'm not having to lean over the patient to push the buttons. So I can easily see what's going on. Now what we're doing now is using a training AED. It will function the same way, but we need to pause it and we need to run through the cycles. It's the easiest and safest way of demonstrating the skill. So assuming the person's carrying on with CPR, the first thing we do is turn the AED unit on.
Training scenario. 1. Adult patient. Call for medical assistance. Remove clothing from patient's chest to expose bare skin. Paused.
What I'm going to do is just pause that for a second. Now you notice to start with, it's saying that we're using adults. Now adults, because if you had paediatric pads in there, maybe they've been put in, you would be able to tell them. So you'd know that there was a problem with the pads. It's telling you audio that's what type of pads in there. Most will always have adult pads in. The other thing it's saying is to expose the chest. We've already done this, so it will then carry on. So we just continue that on.
Pull green tab to remove pads.
So we pick the unit up just so you can see. We're pulling down this tab and we're pulling out the pads. And what's happening now is we're taking the pads out with the wire, place that back down, and the pads themselves are on a adhesive backing. They clearly state where they go. So this one here is just below the collarbone on the left-hand side, and this one's under the arm. So all we need to do is we take the pads and we can peel them off the backing. So just hold the tab at the back, peel the tab away, just lay the other one down, and then we can take the pad and just pop it onto the chest. Push it down firmly to make sure it stays intact and it's on there properly. The other pad, just peel that off. And with this one, we're popping it underneath the arm. Again, make sure it's firmly in place. Now with the pads on, then the next stage of it, the unit will often go straight automatically into an analyze cycle. As soon as it picks up that those pads are in place, it's going on to analyze. Now, because we're using in training mode, I need to tell it that we're then working through analyzing the next stage.
To patient's bare chest, as shown in picture.
So as you're carrying on, you're putting the pads on, it will just keep repeating this message. Once the actual pads are in place, it will come up with a different message.
Assessing heart rhythm. Do not touch the patient.
So So at this stage I need to be away from them. I don't want it to pick up my heartbeat at all.
Analysing. Do not
We also need
touch
to
the
make sure that
patient.
everyone's clear. So we tell everyone to back off. They're not standing anywhere near the patient.
Stand clear of patient.
Just get
Shock
ready with your
advised.
finger.
Stand
Just
clear
holding it
of
over the
patient.
button because I want
Press
to be
the
looking
orange
around to
shock
make sure
button
no
now.
one's there. So I'm holding over the finger. I'm telling everyone to stand clear, keep clear, delivering shock, and I'm looking at them.
Press the orange shock button now. Shock delivered. Begin CPR.
So I'm going to pause that for a second to just explain what's happened. It's done the analysing cycle, we've delivered the shock, and it's now telling me to commence CPR. So again, exactly as we've shown earlier, keep your hands solid above, and we're pushing directly down onto the chest. And with this unit, it's working slightly different from some others because it will also give you help. So it's got a metronome to keep you in time. So you're doing 100 to 120 compressions a minute. It's also got electronic sensors that are detecting the speed and the depth of your compressions. So as you're doing the compressions, just push down.
Good compressions. Good compressions. Stop CPR. Assessing heart rhythm. Do not touch the patient. Analyzing. Do not touch the patient. Analyzing. No shock advised. Begin CPR. It is safe to touch the patient. Place overlapping hands in middle of chest.
So what we've done, we've delivered the shock to start with. We would have done 2 minutes of CPR. Now what I did there is just continual chest compressions, just to make it easier for this demonstration. But obviously if you can do the breaths as well, in which case you're going to need to count to 30. So do 30 compressions, 2 breaths. But maybe you're dealing with this with somebody else and they're not sure what to do, so continual chest compressions are the best one. It then said stop CPR, and then I'm coming away, so it needs to analyse the heart rhythm. So the scenario we've got set up here was that no shock advised for the next time. So this would be a time where maybe the first shock has worked and this person may be starting to show signs of life now, or maybe they're no longer in VF, they're in a systole, therefore there's no way the unit will work, the shocks will not work properly on it. So what we'd do is continue CPR on that stage until the person shows signs of life. The emergency services take over, and when they do arrive, just keep going with what you're doing until they tell you to stop. And otherwise, you just keep going this cycle. And if you're on your own, you would carry on until you start to show you're too tired to continue. But the unit will keep going in this cycle, it will keep giving you the advice you need, and it will help you. With this unit, if there are any problems with your CPR, it will tell you. So if we just resume this, so if there are any problems with your CPR, this unit will tell you.
Good compressions.
At the minute, it's showing good compressions. The bar chart on there is showing green, so everything's working fine. If there was
Push
other
faster.
issues, like now we're saying that they need to push faster, the indication will tell you. And also, once you
Push faster.
go too slow, the unit will tell you to speed up. And when you then get good compressions,
Good compressions.
the unit tells you that as well. So it's giving you lots of help with your CPR, whether you're doing fast, going too fast, you're going too deep, the actual unit is telling you that that's the case. So it's a very good way of giving you real-time CPR help. This is perfect if someone hasn't got that much experience. So in this example here, we're looking at a complete low experience scenario. We've got somebody who's just turned up, the AED unit's there, they're doing continual chest compressions, they've activated the emergency services, all the things they have to do. But the unit is guiding them through. It's guiding them through their CPR. If they're not good enough, they need to do more, then that's fine. So these units are extremely simple and they're just perfect for anybody who needs that extra CPR help.